Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Menopause is a normal stage of life. According to the National Institute of Aging, natural menopause occurs between 45 and 55 years of an age and lasts for about 7 years. But it can continue for up to 14 years, maybe even longer. As many as 75% of menopausal women experience hot flashes and night sweats.
It's a lovely story. I'm so happy to be part of the telling of it. According to some estimates, the hot flashes last for an average of just over 5 years. And the earlier in life they occur, the longer they may last. How can you get relief from hot flashes? We're about to find out. Joining us by phone is Dr. Jewel Kling of the Division of Women's Health at Mayo Clinic's Arizona campus. Hello, Dr. Kling. It's nice to meet you.
Hello. Thank you so much for having me.
Dr. Kling, it sounds like most women do experience some kind of symptoms during menopause.
Absolutely. That is the case. As you had already said, most women will experience hot flashes and night sweats. But there are a lot of other common symptoms like sleep problems, mood changes, weight gain, and vaginal dryness.
And would you say that are there any women who go through menopause who don't have some symptoms?
Yeah, there are a certain amount of women that kind of glide through it and may not experience some of those symptoms. Although it may also be that some women aren't aware of the type of symptoms that go along with menopause. So probably a majority of women will have some of the vaginal changes related to menopause that may occur about 2 to 3 years after they're technically menopausal. But for some, it may not bother them.
Do these symptoms, they're certainly bothersome, and we want to joke about them because there's nothing we can do about it. It makes us feel a little better to joke about it. But are they serious for changing your overall health?
That's an excellent question, and the more kind of research that comes out, we are finding that hot flashes, which we call vasomotor symptoms, can or may predict other risks like risks of cardiovascular disease or heart disease. And so there may be some good reason for us to think about treating them to prevent potentially those risks.
No, wait a minute. Say that again. Are you saying that if a woman has hot flashes, they can lead to other health problems?
Well, it may not necessarily be that they can lead to them, but they may be a sign of something underlying. So there is some studies that are looking at hot flashes as a risk factor for heart disease. There was even just one that came out that looked at women in the Women's Health Initiative, a big study from the 1990s and early 2000s that found that women with hot flashes had higher risk of breast cancer. So there may be something underlying going on there.
It's so interesting to just even think about what some of those correlations might be.
Yeah, absolutely. And there's so much more that we really need to understand. But at the end of the day, if a woman's having significant symptoms that are impacting her quality of life, I think that's really the biggest reason she should and her doctor should think about treating them.
Preach.
Yeah. It seems logical that because I'm presuming that these symptoms are due to the lack of hormones because the ovaries stop working. It seems reasonable that the treatment would be to give the woman hormones if she's having symptoms.
Absolutely. The most effective treatment for the hot flashes and night sweats associated with menopause is hormone therapy. But for some women, they can't take hormones because they have contraindications, meaning they either have had a blood clot or have had a breast cancer, or some women choose not to use hormones. But the good news is, at this point, we know a lot of different therapies that can help treat their symptoms.
Such as?
Yeah, there's the one FDA-approved medication is Paroxetine, which is also called Paxil when we use it for anxiety and depression. But for menopause, it's a lower dose. It's 7.5 milligrams. It can help significantly with hot flashes, night sweats, and sometimes women notice things like mood stability and sleeping better.
So it not only helps with the depression symptoms, but it helps with night sweats and hot flashes?
Absolutely. And when it's prescribed specifically for hot flashes, that's the main reason we're using it. But as you're suggesting, these type of medications are used for depression, so it can help with some of the mood occurrences that happen during menopause too.
And what was the name of the drug again?
It's called Paroxetine. That's the generic name. And then when it's used for menopause, it's called Brisdel. It's 7.5 milligrams, so a much lower dose than we would typically use if we are treating anxiety or depression. And actually the same stands for a lot of the other antidepressants, what we call the SSRIs, or selective serotonin reuptake inhibitors, or another class of medications that are similar. And although they're not FDA approved for hot flashes and night sweats, there's plenty of studies that have shown that they're effective at treating hot flashes and night sweats. So women may talk to their doctor about things like escitalopram, also known as Lexapro, or venlafaxine, which is the same as Effexor, to help with hot flashes and night sweats.
We should also just say that, I mean, I know we're talking about hot flashes, but the mood changes that people can go through when they go through their menopausal stages is not something to be taken lightly either. Some women.
Yeah, no, absolutely. And that may be a reflection of the changing hormones, the loss of the estrogen and progestin, but could also be a reflection of all the other symptoms. Like if you're having flushes all night and you're not sleeping, then of course you're going to be fatigued and your mood's impacted. So it kind of all works together, and if we can treat that core issue, then women are going to feel better overall.
What about some non-medication options?
That's a great question, and there's some good research that supports the use of things like cognitive behavioral therapy, which is like talk therapy, usually with somebody that's trained to do it for hot flashes and night sweats, as well as clinical hypnosis that can be helpful for reducing hot flashes and night sweats.
Really? Hypnosis?
Amazing.
Yeah. And what about, are there any herbs or supplements that you have found, or there's scientific evidence to suggest that they would work?
Well, many of the different supplements that are marketed have been looked at in studies, but what has been found really overall is that none of them are more effective than placebo at lowering hot flashes and night sweats. And what that means is that if women take them, they may notice a reduction in their symptoms, but it would be the same if they were taking a sugar pill. And so I usually share that with my patients and say, if you're having significant symptoms, let's focus on something that we know is going to treat those hot flashes and night sweats and not potentially cause undue side effects. Like some of those supplements can cause irritation to your liver and things like that.
So one other thing you mentioned in one of your articles was about weight loss and hot flashes, that if you lose weight, you might have fewer hot flashes. True?
Yes, there was one particular study that found that in an intervention where women lost weight, that they had less hot flashes. And I think what's really interesting about that study is they found that women knowing that losing weight may reduce their hot flashes motivated them more to lose weight. So at a time of life when women start to experience more risk of heart attack, dementia, kind of in that midlife period, doing things that are healthy like exercise and weight loss are so important. And thankfully, we're seeing that it can help with menopause symptoms too.
All right, tell us about MenoPro, the app.
Oh, yeah. MenoPro is developed in part by the North American Menopause Society, which is a great society that kind of oversees a lot of the research and guidelines for menopause treatment. And they've developed an app where you can put in your symptoms and your history, and clinicians use it to guide therapy, whether or not it's safe to use hormones or not. But there's plenty of patient materials where you can pull up information about, like, what are hormones, why are people concerned about them, or why are they good, that type of information. Because as what a lot of women experience is if you Google hormones, there's a lot of stuff out there that's just misleading and maybe not truthful. So this app and any materials from the North American Menopause Society or really from the Mayo website would be helpful at getting some information.
All right, it's MenoPro, MenoPro, correct?
Correct. Yep, that's it.
All right, menopause, a normal part of life. The majority of women do experience symptoms, up 75% or so, hot flashes, night sweats. Do they need to be treated? Our guest says absolutely yes, and multiple options for treatment. Our thanks to Dr. Jewel Kling of the Division of Women's Health at Mayo Clinic's Arizona campus. Dr. Kling, thanks so much for being with us.
Thank you so much for having me.